And I do actually think that it's important that we remember that when we're dealing with cultural issues, that sometimes it's not just the act, but it is like, you know, all the things around it. So I think that was interesting that they were able to, you know, keep the ceremony about, you know, maybe womanhood and take out the harm element of it. But again, thank you so much to everyone for joining us for this session. We're going to be having presentations from the WHO, collaborating with the Center of Arts and Health. And we have Siasha, I hope I pronounced, okay, fantastic. We have Siasha Finn, who will be kind of flanking this conversation. She's a researcher who's focused on how social, cultural, and community engagements play a role in health. And she's currently undertaking a PhD at UCL, University of London, exploring the interplay between leisure, engagement, social relationship, and mental health. Additionally, Siasha is a network coordinator for the Arts Health Early Career Research Network, and is currently a co-investigator on the Dance Connect project, a research study exploring whether online group dance, affects the social and mental well-being of young people experiencing anxiety. Siasha Finn is an early career researcher working on projects related to arts and health. She's also the coordinator she's also the coordinator of the Arts Health Early Career Research Network and is involved with the Early Career Research Specialist Interest Group within the March Network. She's currently a visiting researcher in the Department of Behavioral Science and Health, where she's the co-author of a health evidence network synthesis report for the World Health Organization on the role of the arts in improving health and well-being, led by Dr. Daisy Fancourt. So great to join you great to be joining you this afternoon, Siasha. How are you?
I'm good. Thank you for having me. So basically the presentation is going to be in two parts. So first of all, I'm going to kind of introduce the WHO Collaborating Centre, and then myself and my colleague, Dr. Laura Wright, who can introduce herself but now or a bit later, it's up to you. We'll be talking about one of our projects that is kind of situated within the Collaborating Centre.
Yeah, I think that's great plan. So I'll pass over to you now to kick off the session.
Great, thank you. So I'm going to start by sharing my screen. Okay, so I think it is this one. Okay, can you see that in full screen?
So we can't see your screen just yet.
All right, sorry, I forgot to share.
Okay, there we go. Yes, we can.
Okay, great. Okay, so let's start. So yes, thank you for the introduction. Just put this down. So my name is Siasha Finn, and I'm a PhD researcher at UCL. So as I already mentioned, today I'm going to be talking to you about two things. So the first is to introduce you to the new WHO Collaborating Centre for Arts and Health. And the second is about a research project alongside my colleague, Dr. Laura Wright, that we've run that is situated within it. So our department, Behavioural Science at Health at UCL, has recently been designated a WHO Collaborating Centre, or CC for short, for Arts and Health. So this is directed by Dr. Daisy Fancourt and Dr. Katie Warren as Deputy Director. And I am a PhD student within the centre. So a collaborating centre, or CC, is a centre designated by the WHO to carry out activities in support of their aims. So currently there are over 800 of these collaborating centres across the globe, but our centre is the first one of its kind to focus specifically on arts and health. So this is a very exciting development. So the Collaborating Centre has three core aims. So the first is to carry out world-class research into how the arts, culture and heritage affect mental and physical health. The second is to work with world-leading researchers in the UK and internationally to develop and improve arts and health policy globally. And the third is to provide training programs, toolkits and resources to support the development in the field, including facilitating opportunities for early career researchers. So I'm going to briefly tell you a little bit more about each of these three core aims. So through our behavioural science workstream, we're working to understand who engages in the arts and how this engagement is patterned based on individual characteristics, the context in which we live and grow, and geographical factors. So we're exploring how engagement changes across the life course and how it is associated with other social and leisure behaviours. Through our clinical trials and implementation science workstream, we are designing and testing new arts programs for specific clinical outcomes, running clinical trials to test their efficacy, and then working to implement them in a sustainable and scalable way and secure National Health Service commissioning within the UK. Through our epidemiology workstream, we use advanced statistical methods to explore the associations between arts and cultural engagement and prevention and management of mental and physical illness at a population level. And then finally, as we all know, the arts are quite complex activities. So for our complexity science workstream, we're developing new theoretical models to understand how and why the arts affect us. So our second aim is to work with world-leading researchers in the UK and internationally to develop and improve arts and health policy globally. So with the WHO, we've published several major international reports and briefings on arts and health. So our 2019 WHO Health Evidence Report was actually the most downloaded evidence report of 2019, so that's very exciting, and was also named the Global Aesthetic Achievement of the Year. We also work closely with the UK government and the UK Arts Councils, producing policy reports, giving evidence to government select committees, advising government departments, sitting on all party parliamentary groups and consulting on strategy reports. With the Collaborating Centre, we're also planning to extend this policy work to international contexts. Our third aim is to provide training programs, toolkits and resources to support others and to support development in the field, including facilitating opportunities for early career researchers. Already, we have developed a number of tools for research, which are available on the new website, focused on kind of implementation and research. And this will be added to over time as new tools are being developed. We will also be providing training opportunities. So currently our online short course, you can see in the top right, was a partnership with the Royal Society for Public Health here in the UK. That was launched as a three-way partnership between the Royal Society for Public Health, the new WHO Collaborating Centre and the existing March network. It is a free training programme for early career researchers, and it introduces the theory, evidence and practice and arts, culture, heritage and health, and helps you think a little bit more about how you would design a kind of a research study and what the potential ingredients are within the activity and the mechanisms that you might be interested in looking at leading to kind of improvements in health. We also run our annual Arts Health Research Intensive in partnership with the University of Florida. So this is a 5-day residential course that provides training in theory and research methods so that participants can strengthen their skills in designing and undertaking high quality research studies and also form a network of colleagues for international collaborations. So at present, the course is actually running this week in the UK. So you might be seeing some on Twitter about Health Early Career Research Network, which I co-lead with Dr. Katie Warren, working on projects that lie at the intersection of the arts, humanities, health and medicine. And finally, the Collaborating Centre is committed to supporting PhD students, and I believe they are currently accepting doctoral students. So that is just a kind of quick fire kind of tour about the new Collaborating Centre. But if you'd like to find out more, please visit the new website. There's a link and you can sign up to the quarterly newsletter to get updates. And if you're on Twitter, you can also follow at Arts Health CC. So thank you. There'll be time to ask questions about this at the end of the next presentation. Okay, so moving on. I'd like to discuss with you an arts and health research project myself or other colleagues in the team have been working on. So today from the team, we have myself and Dr. Laura Wright presenting, but I also want to give a shout out to our lead investigator, Dr. Katie Warren, and co-investigator, Dr. Karen Mack, as well as our partners at DanceBase, as well as a number of other team members supporting the project, which I'll speak about a little bit later. So basically, this research project is in partnership with DanceBase. Now, DanceBase are Scotland's National Centre for Dance. And with this research project, our aim was to explore whether online group dance could support the social and mental well-being of young people living with anxiety. And we're excited to tell you a little bit more about this today. So to tell you a little bit more about today's sessions, we're going to start with a brief overview of the design of the study and why we felt it was important to do this research. This will be followed by just a quick showing of the kind of dance that we did. Then I'm going to present some of the quantitative findings. We'll have a quick break. Then you're going to hear from Laura, who's going to discuss the participatory aspects of the project, present some of the qualitative findings, and share some of the insights from our youth advisory, who co-designed the study with us. And I'll speak about that a little bit more in a bit. And this will be followed by a Q&A. Okay, so the rationale for conducting this study was that our understanding is that anxiety is fairly common amongst young people. And research conducted during the pandemic was showing worsening mental health symptoms for young people and also young people with existing anxiety. So we wanted to implement an intervention that may support young people during this time. And we knew from previous research that in-person arts groups could provide support, but we didn't know if this could translate into an online context. So one of the key mechanisms that had shown in-person arts groups provide support for mental health was through the construction of a shared group identity relating to feelings of group membership, group support, and group belonging. So this approach is known as the social cure approach. But again, we didn't know whether online groups had the same potential to support mental health through these group level factors. So kind of in view of the broader evidence showing that in-person dance is able to support mental health, combined with some of the anecdotal evidence that DanceBase collected of people participating in the online dance classes during the lockdowns here in the UK, we chose online dance classes as an art form in which to explore the following 3 research questions. So our first research question was, do young people, so young people aged between 16 and 24, living with anxiety, experience perceived changes to their social and mental well-being as a result of weekly online dance participation? And if yes, do participants attribute any of these changes to the co-construction of a group identity created through these shared online experiences? And then lastly, what are the underlying mechanisms that support these potential improvements to social and mental well-being, and how are these moderated by the online context? As you can see here, we took a mixed methods approach, triangulating different methods together. So we brought together qualitative, participatory, and quantitative approaches, and framing our work within a theoretical framework of the social cure approach. We wanted to collect a range of different types of data. So as well as numerical data, we had word-based and visual data. So this study involved delivering 2 courses of 8-week online dance classes, and shown in the diagram is a visual representation of our recruitment and data collection process. So firstly, we screened participants who were interested in the project to see if they were eligible to participate. If they were, we then invited them to consent into the project. Now, if they weren't, we then offered them advice on other places where they may be able to access free arts activities that could help support their well-being. For those who consented to take part, we collected a baseline survey, which included psychological scales, which were followed up at week 4 and week 8. So we could track changes over time to mental health and also kind of their attitudes towards a group and group belonging. So some examples of the quantitative measures are listed on the screen here, such as social support, anxiety, loneliness, and group bonding. And then at week 4, we began our qualitative data collection, asking participants to submit a creative journal reflection to us in the form of an image, video or poem that they felt represented their experience of the classes, alongside a short written explanation. We then carried out focus groups at the end of the classes to explore people's experiences of engaging. In the focus groups, we use a creative method called the River of Life, which we'll be talking more about later with Laura, alongside a range of questions on the topics that are listed here, such as asking about group membership, mental well-being, and barriers and enablers to engaging with the project. In total, we screened 86 people for eligibility, with the criteria for this listed on the screen here. So basically, we were looking for young people aged 16 to 24 who were living with anxiety and who were able to access the online dance classes. Of these 86, 69 people were eligible and 35 consented to take part. 27 then went on to do the dance classes. As this is a pilot study and as a project was primarily a qualitative study supported by a quantitative component, this number of participants can give us an idea of questions we set out to explore in the study qualitatively. But we do hope in the future this project could be scaled up and also include a control arm randomization for the quantitative side of things. So we had different advisory groups. Now for us, including the voices of young people at every stage of the study was very important, as we understand the importance of co-production in research. We had an intergenerational advisory that was made up of more senior kind of experts in the field, young people, and then also individuals that actually had experiences of anxiety themselves. And then we also had a youth-only advisory as well. So we had 8 advisory meetings in total, and our activities and discussions very much kind of informed and shaped the design and the delivery of the project. And you'll hear some more later from the experiences from the youth advisory later on in the presentation that they wanted us to share with you today. Okay, so I'm going to show you a short video kind of showing the style of dance. So unfortunately, our wonderful dance teacher has other commitments today, so we're unable to kind of do a demonstration of the dance with you, where you'd learn some of the movements that young people learn. But we do have this video. Although this is not from Dance Space, this video excerpt really gives you a kind of a good idea of the style of the dance in the classes and the kind of the view that the participants would have watching the dance teacher. So hopefully this works. I just need to, I think if I click here and I'm gonna take it. Okay.
Last time to the left. Really follow the arms. Great, easy. Great, good stuff. So little tips here.
So just to give you a kind of idea about the kind of movements that were kind of done in the dance classes. But if you have any more questions about the content of the dance classes later, feel free to ask in the Q&A. Before we have a quick break, I'm going to give you a snapshot of our quantitative findings. So I was just checking the comments. Yes, definitely feel free to join dancing with that. Okay, so this basically this slide shows some of the demographic information of the participants in our study. So the average age of the young people was 21, but as you can see, the sample was majority female and white. And although not shown here, individuals did indicate quite high socioeconomic status. We had 27 participants at week 1, 18 at week 4, and 14 that continued to week 8. So one of the questions that we were interested in was to understand the participants' kind of general arts engagement. So we asked questions about kind of how often before the COVID-19 pandemic people engaged with the arts, their engagement throughout the COVID-19 pandemic, and whether there had been kind of any changes to their online arts engagement because of the pandemic. Interestingly, the data suggests that people now engage more with online arts activities than they did prior to COVID-19. And typically, you might see that for someone to engage in an arts activity or join an arts and health project, that they might already be someone who's quite engaged with the arts. So if someone is less engaged, you might see that as a barrier for them wanting to join an arts project. But here we see that actually a majority of the people that enrolled into the study engaged only in the arts about once a month or less. So quite infrequently really, but regardless of that, they still joined the dance project. So that's interesting. Now to present some of the quantitative results. So just to explain this. So these graphs show visually the changes in scores for our measures of anxiety and loneliness for our participants across the 8 weeks. And the below tables indicate by how much these changes occurred and when they occurred. So on the left-hand side for anxiety, we saw evidence of a reduction in anxiety across the 8 weeks, particularly between week 1 and week 4, and between week 1 and week 8, where we saw evidence of the biggest changes. So this actually moved the group from a profile of kind of moderate anxiety to mild anxiety, although we don't know whether those who were more anxious did in fact drop out, or whether we would see these changes if we had compared to a control group. But nonetheless, for loneliness, we also saw evidence of a reduction in individuals feeling lonely across the 8 weeks, and particularly the largest changes between week 1 and week 4, and between week 1 and week 8. So on the left for depression, you will see that there was evidence of a reduction across the 8 weeks in kind of feeling depressed, and this looked like the biggest kind of reduction happened between kind of week 1 and week 8. And on the right, you can see the results for kind of group bonding. So this is for kind of how bonded people felt with the dance group and with others in the dance group. And we saw evidence of an increase in how bonded people felt with the group, particularly between week 1 and week 4, and between week 1 and week 8, where we saw evidence of kind of the largest changes. We did look at a number of other measures that I haven't presented everything here today. Generally, all of our mental health measures saw evidence of change, but actually for the group attitudes and group bonding was the only one that actually indicated any changes when we ran statistical tests, which is interesting and something that we're kind of picking out within the qualitative side of things. Yes, good point. Yeah, so we used online questionnaires that we sent out at week 1, week 4, and week 8. Okay, so in summary, the quantitative findings suggest that there may be reductions in anxiety, loneliness, and depression across the 8 weeks of online group dancing, as well as increases in how bonded people felt with the dance group. We think these results look promising for a pilot study, but from a quantitative perspective, it would be great to see this scaled up for a large number of participants, have a control comparison arm, employ randomization, and have a more balanced and representative group of young people living in the UK in order to further explore the potential benefits of online group dance for all young people experiencing anxiety. But after the break, you'll hear our main findings from the participatory and qualitative aspects of the project. So stay tuned. I'm going to check the chat box now and see if we have any questions. I can either answer them after the break or in the Q&A. But we're going to break for just 5 minutes and then kind of come back and you're going to hear from Laura. But you will need a pen and paper for this next section, so do grab that, and I will see you if you have a quick break at, I don't know, maybe 33 minutes past, if that's okay for everyone.
Sounds great. So enjoy whatever you need to feel energized for the next part, and we'll have a chance to be interactive and learn about the participatory and qualitative components.
Okay, so it's just gone 33 minutes past. I always think it's good to have a quick break when you've kind of had a lot of information thrown at you. And I think Laura answered most of the questions during the talk, but there was a question from Ashley about what method did you utilize to analyze the data. So speaking from the quantitative perspective, we use a method called repeated measures ANOVA to look at within kind of subjects changes across the different time points to see, so for instance, how anxiety or loneliness kind of changed over time for each participant, like compared to themselves. And we use a statistical analysis program called Stata. Yes, and then you're going to hear a little bit more from Laura about the qualitative and participatory stuff, and I'm sure she'll be able to comment on how that was analysed. So can I pass over to you, Laura?
Wonderful, thank you very much. And if you want the slides back up as well.
Sure.
Okay, so I'm going to speak to the participatory methods that we use throughout the study and our qualitative component. Next slide, please. My name is Laura Wright. I'm a teaching and research fellow in childhood and youth studies at the University of Edinburgh, and I'm a director for participatory methodologies with the International Institute for Child Rights and Development. My research focus and background is really in play and arts-based methodology, children's mental health, child protection, and psychosocial well-being, with emphasis on children's rights and working in partnership with children. The participatory research, just a bit of a background, is really exploring and involving, recognizing the importance of involving young people, and that there's a wide array of tools and approaches that can be used in participatory research. So this may include art, theatre, play, creativity, and it's something that is recognized to have meaningful participation, working in partnership with community members who the research is about and with, and looking at how you can explore and create spaces both verbally and non-verbally to share and learn within the research process. Next slide, please. So one of the tools that we used as part of this study was called the River of Life. So this can be used in many different ways across programs, across experiences. For this study, we used the River of Life at the just prior to the last week of the dance classes as a part of a focus group discussion activity. So the river allowed us to reflect on their journey being in the online dance class. So how they felt when they began, how they felt in the middle, and how they felt kind of near the end going forward into their future. What were some of the different strengths and challenges? What were they feeling socially and emotionally? And allow for them to draw and reflect and then lead into a facilitated discussion, really delving more deeply into some of the particular areas in relation to the research question. This type of activity can take an hour to an hour and a half, sometimes even longer, depending on the focus, but can be done in many different ways. So we're going to have an opportunity to play a little bit with it as well ourselves over the next sort of 5 to 10 minutes. Next slide, please. So let's give it a go. So I invite you all to take your pens, your markers, whatever tools you have with you, and a piece of paper. You're going to draw a river. So you'll have one from the start on one side. So your river cuts across your page. You'll do start, middle, and then you'll have end into the future. And I want you to reflect on a project, maybe a research project or a program that you've been working on recently that is sort of coming to an end, or you might still be partway through. And I want you to spend, let's go for 5 minutes, reflecting on your experience. So you'll draw that across, and then you can use, so can you go back to the last slide, actually? And you can use the image. So you can see with this creative one from the group of youth I worked on, this is an in-person one. You can use images to highlight kind of key strengths and challenges, stones. You can use big words, so however you'd like to present that. And then you'll take 5 minutes now, just draw that out on your page. Does anyone have any questions at all? All right, well, there's no questions. So at 42 past the hour, we will come back together and you'll have the opportunity to share a little bit around your reflection and your experience. And so I invite you to take a couple more minutes to continue to reflect, put some more images and words on your page. Wonderful. So you want to wrap up your final piece and then we'll come back together. Would anyone like to share their image? You can hold it up or just share some reflections on what you put there. You can feel free to turn on your mic or put anything in the chat as well.
I'm happy to go, just to kind of to get it going. Yeah. I was thinking of kind of about my PhD journey, and I think it's quite interesting when you kind of think about it and think about the start, the middle, and the end. And this is kind of what I've come up with. It's not very beautiful, but I think it's quite like representative. So I think at the start, you can see I've kind of done myself as like a medium size here, and I'm quite excited. But I have lots of questions, but they're not very refined. They're all muddled, and I'm like, what's going on? I have so much to think about. And then I kind of get to the middle, and I kind of I don't know, like facing like a bit more barriers and kind of rocks, and then kind of pushing through, kind of learning new things, kind of getting comfortable, understanding the process of doing it, and now kind of feeling quite like small, like, whoa, where am I going? And then kind of as we're kind of going through it, now I'm kind of more relaxed here. I'm like lying down, having a drink, like the water's really calm. I'm feeling a bit bigger. I still have lots of questions, but they're very much more kind of calm in my mind. So that's kind of how I've kind of represented it. I don't know how you would analyse that, Laura.
Wonderful. Thank you so much for sharing that. I think that's such an important piece too when you are using this tool, is recognizing people have their drawings, but you really want to invite them to explain them, to share them, what that means to them, as we may perceive something differently than what you're sharing. So thank you for sharing your journey. Does anyone else want to share any highlights from theirs? And you can share your whole journey or just some reflections.
I guess so. My journey is still going, so it's not at the end yet. So I mean, let me know if you can see it. But we're currently working on an art school, and so I started off. My first picture is actually the book, because we have a book that's around the pedagogy of the training, and that's kind of how, that was what we're building off this new session of this project about. And then here having meetings, starting all my Zoom meetings, getting the open call out and selecting the participants for that, and obviously more meetings, but starting to get the hang of it, so really being a bit happy about it all. Fundraising, then meeting the entire team and planning still. And then here I am, like almost at the end, because we're headed off next week. And I've kind of said, because it's becoming really serious now. It's but also excited, like, here we go.
Oh, wonderful. Thank you so much for sharing that reflective journey with us. And also congratulations on your project. It sounds like an exciting piece too.
Thanks.
Thank you. And we have time for one more if anyone else wants to share. And you're welcome if you don't feel like sharing out loud, but just to hold on to those pieces, add more detail to them later too, reflect further going forward, and see what that can mean for you. This tool is a piece that can be used in your own projects, if you're working with children, young people, adults, to reflect on an experience, either as a research tool or as even a monitoring and evaluation tool of a program that's existed. We've even done them at end of conferences before. So there's many different ways it can be used. With the children and young people we were working with, we were doing this online. It's part of the online process, so similar to what we've done here. You can also, when you do this in person, people can use their own independent ones, and then they can also, or they can do large group ones as well. How do people feel reflecting on a particular aspect, a particular journey of their life? You can either speak or do a thumbs up, a thumbs down, whatever suits you. Great, so some useful experiences and reflections. Thank you, Linda. Thank you for sharing. A mindful space. And this can be a nice reflective process for people, at the end of your course. It's going to be a useful journey tool. And that might bring up experiences and feelings that you might not have thought about before on your own journey. And so it's also valuable when using it to have different support systems in place, because they can bring up really positive experiences. Someone in our last session we presented highlighted that it was valuable for them because they're about to start a new project that they're quite nervous about, but they had reflected back on their last one and recognized that during different parts of that river, they had a lot of anxiety, but they also had a lot of excitement, a lot of joy, that positivity of the final journey and the success throughout. So it was a nice reminder for them when starting something new that you do go through these ups and downs of emotions and strengths and challenges across journeys throughout our lives and different projects we're engaged in. We can share a copy of the tool with you as well. It'll be lovely to use it for Arts and Medicine Fellowship and your festivals. So we'll share it over with you, and you can adapt and modify it for whatever types of questions you want to add as well. Next slide, please. So now I'm going to share just a bit of a snapshot of our qualitative findings. So these were some of them. That tool is one of the tools we use for focus groups. We also had people kind of share different images reflecting on their experience partway through. And with these qualitative findings, we're still doing further analysis. They're being thematically analyzed using in vivo software that constructing the environment or the team, improved mental health, and engaging the body in dance and movement. So the first one was really looking kind of at the idea of a sense of shared experience people felt through the online space. The importance of the practitioner. So as it was online, people often saw the facilitator, the dance instructor, kind of leading, engaging in the process, and there was just feedback that really helped them to feel energized and motivated and safer in the space. A space of shared emotion and mixed feelings towards the online engagement. So some really loved the online space. They felt, particularly with high anxiety, that leaving their house wasn't something that they were comfortable doing. One or two spoke to, but that being able to be in their own home and the safety of their own home and being online worked well for their lives and for their schedule. Improved mental health, feelings of calmness and reduced stress, particularly during the days of the dance class and slightly after, and improved mood and improved feelings of well-being in comparison to their wider life. So it was also something where they felt grounded and more confident within their own selves. And engaging in the body in dance and movement. So we were looking at, it was interesting because we were looking at social connection within the study, but there was also a lot around connection to self. And so the social relationship with their own self and the relationship with mind and body through that embodied process of engaging in dance and reconnecting with their own body awareness and improved body image. There was also kind of improved body health in certain ways too, For example, one young person spoke of that she hadn't been showering regularly for a while, just with everything happening, and the dance class, because she was moving so much, it gave her like a regular point in time to take a shower. So to like have, you know, to keep clean, to have this regular part in her schedule. Someone else spoke to like inconsistency with their eating habits, and the dance class reinforced their hunger, their nutrition, and what they were doing. So there was different elements of relation to body that were present, that were surprising findings as well within the study. Next slide, please. Some quotes that emerged. We're looking at a safe space. In comparison, an in-person dance class where you feel like more of a part of a group, online you sort of feel like you're more part of the space, and it's part of a nurturing environment. We asked them about feelings of sense of belonging, and people highlighted like you didn't need to belong because you just really felt open, so anyone could belong. So it wasn't necessarily that you had to fit in. It was just very welcoming. It was like, it wasn't, as I wouldn't quite like call it, a sense of belonging. I think maybe just like a team. This was quite important, actually, discussion that emerged, and I was in this focus group, was that one young person felt the idea of belonging actually perhaps suggested that there was people who could not belong. And then it could also be an exclusive term. And so she had highlighted, how can we look at it more as welcoming? Because she felt everyone was welcome in the space. And there wasn't an opportunity to say someone did not belong because everyone was there. So sometimes these are also people's own experiences with words. And she had perhaps experiences where she felt she didn't belong. So the word itself, she didn't enjoy using, but she felt the space was quite welcoming and engaging. Next slide, please. So lots of interesting findings emerging, and much more as we get into analysis. I'd also like to speak a bit to the youth advisory component. One of our fabulous youth advisors, Georgia, was going to come, but unfortunately with her schedule, she wasn't able to, but she did put some great notes for us. So I'll just highlight some of her reflections that we've been speaking to in the last few weeks. So the dance youth advisor role, we had sort of 4 consistent youth advisors and a few others initially who really contributed throughout the process to the design, like helping to choose what type of dance was used, with some of the creative activities, and also facilitating. So Georgia facilitated focus group discussions with me and this river journey activity. She felt that being on the committee was a flexible way to gain complementary experience and skills that she could use in other spaces. And she really liked the interdisciplinary nature of this type of research and an empathetic approach to research, with recognizing and respecting and validating our differences within a space. Next slide. She also highlighted the value of the intergenerational advisory. She was quite worried because we had adults from around the world who were part of this advisory who were kind of considered, experts within the field. So she was concerned about if she had anything to contribute. But she's highlighted several times that she felt quite validated by the experience, and that she felt really welcomed and that her ideas mattered within the space, and she was co-contributing. We asked her a bit about the idea, do you want to be called a youth member? What does that look? And I think she and the others both had conflicting feelings on this. The idea that sometimes it helps to really reinforce the importance of having youth in a space, but also sometimes, do we need to call people youth? Do we need to create that difference when everyone's kind of equally contributing and sharing as part of the advisory itself? Next slide. So these are kind of pieces I was just mentioning around being involved at every point along the way and offering insight into each of the steps that are also a part of the analysis, and we'll be writing a journal article on as well. Next slide. Also, one thing that Georgia highlighted when we were last presenting on this, and she was co-facilitating the river journey with me, was that the river journey was quite an experience she really loved facilitating. She had been concerned to facilitate beforehand, but we did a training session, and it's something that now she's embedding into other aspects of her own work. She's doing some master's research right now, and she's looking at kind of these pieces of dance and connection. So a bit of a summary is shed more light on the I'm just looking at the questions as we get into it, shed more light on the intergenerational dance engagement with the young people. So the actual dance classes were all designed for youth, so they were young people. But the intergenerational advisory was the people who supported to design the research and also decided then, you know, what type of dance should be used that would then connect with the specific focus of this research. And so they met several times to kind of contribute to aspects of the design, the research tools used, and ideas around the analysis. And then the youth advisory met more frequently as they were really contributing and reflecting on kind of the sessions and what they looked like and how we would be collecting and analysing data. So in summary, this was a mixed method study exploring benefits of online dance for young people with anxiety. It was part of a loneliness research grant, so looking at aspects of social connection and mental and social well-being. Preliminary, the quantitative findings suggest a reduction in anxiety, loneliness and depression, as well as an increase in group bonding. And the emerging qualitative findings theoretically developed a social peer approach from the group to the environment, so really recognizing it as a mechanism for improved health. We are currently writing different pieces up. Will be over the course of this year. And so there's opportunity, we can share some of the journal articles and reports once they're done and able to share. But if any of you are on Twitter, you can find us on Twitter here. And you can also go to our website as well, and we can continue to share other pieces. So thank you all very much. Now open up for further questions.
Thank you, Laura.
Does anyone have any other questions at all?
Yeah, I do have a question for you very quickly. Thank you so much for that brilliant presentation. I'm so fascinated by the incredible work that you're doing. Few things I was going to ask. I want to ask about the content of the dance. So what kind of dance, what kind of music? So who chose the music? So was it the young people that chose the music, or you decide what kind of music they dance to? So where's
It's a great question. And this was actually so many conversations around this piece. And this was, so we had the intergenerational advisors, so not those who are the dance participants, but those who are helping to plan, help to decide what type of dance classes would be used. We ended up doing a bit of mix, so like the contemporary that Saorise was sharing, but a few, because it was a new dance for people too. For some people, there have been conversations, for example, around ballet, and it was chosen not to do ballet because it can be quite structured, which can have pros for some people for their mental health, having that structure, and also negative impacts for other with that being over-structured. So there was a lot of dialogue around types of dance and what could be used. But then it ended up being the dance instructor who then made the program. We fed back on it and brought in a lot of different types of music. And the music itself, the youth, some of them really loved. One was highlighting she kept the playlist, and when she was feeling down on days that there weren't dance class, she'd just turn it on in her house. So there's kind of different ways that people were using the music. I don't know if you wanted to add anything else.
Yeah, no. Sorry.
Go ahead.
Oh yeah, no, yeah, definitely. Following what Laura said at the beginning, we really wanted kind of to hear the perspective from young people themselves about, what would you want to kind of dance to? And there were different options. There was ballet, there was kind of like jazz and musical theatre, there was a contemporary, which is what we went with. And actually there was also the option to have like a medley, so a mixture of different styles, which actually the young people were actually quite keen to do. But actually that would have meant that we would have had different dance teachers. So then we kind of discussed with them that actually we'll just stick to one style, because we felt having the same dance teacher each week was going to be really important to kind of support the group and maybe kind of create a sense of identity, especially with the young people who are feeling, quite anxious. So the kind of youth advisory kind of went with contemporary. And we also felt it was, as Laura's saying, people didn't always have dance experience. So I think it just, when they saw ballet, it might put you off a little bit because you think it's very technical. You also see it as quite an elitist, like high art thing that might not be accessible to everyone. Whereas contemporary was a lot more about kind of free flowing movements. And I think so yeah, there was that aspect of it. And yeah, like Laura said, the young people liked the music, and I believe that they did kind of contribute to the playlist as well. And they had discussions around the music and stuff, and they actually said the music was kind of an important part of their enjoyment of the classes.
Amazing. I was going to ask the next question very quickly. I know there were differences in between the sessions that you had, depending on what music some people actually favor, right? So I was going to ask, how did you manage the differences that you actually experienced while putting these people together, in terms of, were there young people that felt left out? Because like maybe they feel like, this is not my thing. Like you said, let's do this. And they're like, okay, even the contemporary, they know like, I don't want to do this. So were there situations like that? I mean, was it a perfect situation? Like, is this good for you? Perfect. Join. And then, yeah. So just here, were there people that pulled back because they feel like, yeah.
Yeah, well, when we did the recruitment, the dance type had been chosen, so they knew which type of dance they'd be doing when they were signing up. But you know, we did lose a couple of people along the way, and that was for different reasons. Like, you know, for some it was just the timing, the schedule, their own anxiety, because part of the criteria was, you know, having anxiety to participate, and so that can affect people differently from throughout the dance class itself. And so there were different experiences of those who felt more connected to it, and those who were still like, you know, over time they became more connected. And this was also evident in things like people who would turn their cameras on or not throughout as well when they were dancing, and how they were feeling. So it's interesting to reflect on some of those pieces too.
Amazing. So what would you say is the next big thing for you? Was the projection for you? What next after this study? What's the next step for you?
Love to continue this research. We just, you know, we need to find another source of research funding for it, because it's a small pilot, but there's so much potential to look further, you know, at online dance, or in relation to dance in person, or other types of arts-based social like medium, and also cross contexts. So, you know, we could look at it more internationally and what that means in different spaces. I think there's a lot that's emerged here that we'd like to further explore. I know Saorise and I, both in our own other work, these pieces interconnect. Like, we use a lot, you know, I use a lot of participatory methods and focus around art and play. And, you know, there's these pieces that I think our learnings will feed into other research as well, but it would be wonderful, I think, if we could continue this piece. And the youth have been involved. Well, youth advisors, I think, would be quite keen as well.
Amazing. I believe Oyinda want to ask a question.
Yeah, I did want to ask, so what's the legacy for the youth advisors?
It's a great question. It's something we're exploring with them as well, is like what they'd like going forward. I think, you know, at present, as we're sharing pieces, we've invited them. They presented at different conferences. They've, like, a couple presented at a conference last week. There's kind of space to share different blogs or pieces out. We've also, you know, are available. We've highlighted if they want things like reference letters or kind of next steps of how they can be engaged. I'd be quite keen, if we do get any more research funding, to bring them back on, either as research assistants or in other types of roles. So I think there's a few ways, but it's something we're still exploring. Yeah. It's always tricky with research projects when they come to an end. It's like, well, you know, how do we continue these pieces on, and what works best for them too.
Fantastic.
Thank you.
Thank you.
Does anyone else have any? Okay, go ahead.
Are there any? I don't know. I was just asking if anyone had any more questions, but yeah, I mean, if you could maybe just write down the website details again for us in the chat, and maybe just say it as well, so that for the recording, you know, if people are interested, or if people have just entered the room after, just where they can find out more about the project and some of your toolkits as well, how they can access them.
Yes, so our Twitter is @dance_connect_. So I'll write that again into the oh, Laura's faster than me, already done it. So yeah, you can follow us on Twitter, or you also have our website as well.
It looks like the website's currently down, but this website normally works, so there might just be an issue. So if it's not working later on, let us know and we can connect with our project investigator on it to see.
Cool. And I think we also have this website that's from DanceBase as well. So there's some more information on there. So I guess we'll be sharing our updates on Twitter and also on the website if you don't use Twitter. We anticipate there's probably going to be maybe like two or three publications, like research publications of the findings. So kind of one looking at the interplay between kind of the qualitative themes from the focus groups and the quantitative and how that kind of supports it. And then one that's being led by Laura, kind of all about the participatory approaches side of things. And we are also developing a toolkit like alongside DanceBase, who are obviously our cultural partners, kind of about how to kind of implement kind of these kind of dance for well-being kind of classes for kind of organizations working in this space that maybe haven't worked specifically. They might do dance or kind of online dance, but they might not specifically have worked with people from kind of different populations that are interested in the health side of things. So to provide a little bit more kind of information on that. And also I think it's in June, we are presenting again kind of the full findings at something called the kind of the UK Loneliness and Social Isolation and Mental Health Network, but the details of that will be shared via our Twitter, and I'll also try to make sure that gets on the website for anyone who doesn't use Twitter so that you can follow.
Perfect. Thank you so much. It's been really, really insightful. Great to hear about the findings, and of course, yeah, we look forward to reading the papers and also connecting, participating, downloading toolkits, and utilizing.
Yeah, I was going to ask a quick question before Laura leaves.
Oh, sure.
I was thinking about, I mean, what is possible in terms of maybe as the project progresses in the UK in terms of exchange with maybe dancers from Nigeria, maybe kind of cultural exchange dance experience. I'm just thinking about that. Maybe that is something you're open to, so that we can probably have some young professionals, dancers, even if they are not professional, of course, like you said, you don't have to be very good at dancing, but now dance can actually become like kind of a means of expressing yourself, a means of you just being able to tell your story and all of that. So I'm just thinking of what is possible out of this conversation, out of your presentation today, in terms of like moving forward. You have other things you want to do, but we're thinking of, okay, how can we, in terms of like maybe have an exchange experience between young people in your program and young people in our program in Nigeria, to have maybe kind of an exchange, dance exchange experience. So maybe that's something you might be interested in. I would love probably to speak with you and also to speak with our PhD researchers. So I'm trying to pronounce your name, but it's kind of difficult for me.
No, it would be great to have a follow-up meeting and see, like, as well too, you know, are there even research collaboration like internationally cross country around some of the different dance experiences? Station and I, like as researchers, you know, don't work with the dance class particularly, but our colleague Amelie works at DanceBase, that our partner, and so there could be neat ways to actually partner with different dance classes, like programmatically as well, but then also kind of explore if there are any future research opportunities alongside.
Wonderful.
Yeah, feel free.
Thanks so much for having us as well. And yeah, we really need to hear more about